Hello, my name is Megan Romero, also speaking on behalf of Lucian Strupp and Tori Thorsted. We are from the OHSU School of Nursing, Klamath Falls campus. Our group has had the privilege of working with the Klamath Regional Health Equity Coalition for the past 10 weeks. The purpose of this project was to gather information regarding barriers to health, inequities, and resources specific to those currently living with disabilities in Klamath County. It is important to understand the difference between inequality and inequity because KREC's mission is to, and I quote, explore ways to eliminate health disparities and inequities in underrepresented and underserved populations. As the picture represents, equality provides the same resources to all demographics, while equity provides resources for the specific needs of the individual. Disabilities impact the lives of thousands of Americans each year. Disabilities are comprised of, but not limited to, physical, mental, and developmental impairments. The three figures seen here depict the prevalence rates of American adults living with disabilities. Nationally, 9% of adults aged 18 to 64 years old currently live with a disability of some type. In comparison, the United States Census Bureau stated that 14.6% of residents in Klamath County under the age of 65 years of age had a disability between the years 2010 and 2014. This is less than the state of Oregon average of 22%. After the age of 65, the national prevalence of disabilities increases to 27%. However, this information is unavailable for Klamath County specifically. Social exclusion has been known to negatively impact the overall health of an individual. Jackson and Saltman identify factors such as family breakdown, depression, substance abuse, and identity loss as outcomes directly related to social exclusion. People with disabilities are often avoided due to the common stereotypes and stigmas associated with this demographic that further promotes social exclusion. For the purpose of this project, Klamath County was the only geographical area included. As stated previously, the types of disabilities included in our research consisted of physical, mental, and developmental disabilities. Those who participated in this research effort were between the ages of 18 and 64. There were a number of limitations that impacted the data gathering process during this project. Time restraints limited access to a larger age range, as well as inclusion of other established resources within the area. Key collaborators on this project included community members, KREC, Southern Oregon Regional Brokerage, also known as SORB, Spokes Unlimited, Klamath County Developmental Disability Services, also known as DD Services, and the OHSU School of Nursing. The overall themes that guided this research were barriers to health, established resources, and areas for improvement. Initially, secondary data was gathered to gain background knowledge on this population. Primary data was then collected through the use of several focus groups and key informant interviews. After data collection was completed, common themes were interpreted through the use of data analysis. 5 overall themes were pulled from the data analysis and include physical health, social exclusion, navigation of systems, barriers, and effective resources. When asked if participants considered themselves healthy, community members only identified a healthy lifestyle as it relates to physical health. Those who viewed themselves as healthy stated that they were in good health if they did not require any medications and their blood pressure and lab values were within normal limits according to their physician. Spiritual and mental health were only acknowledged after further prompting. Further discussion determined that it is difficult to care about community health when adequate personal health is not being obtained. A correlation became apparent between those who view themselves as healthy and those who have a strong social support system. One of the greatest needs addressed by those we spoke with was a desire to be included. Community members identified a number of reasons that contribute to social exclusion, including lack of understanding, minimal access to information, differing philosophies surrounding core belief systems, and inability to participate in community activities due to their individual disability. Navigating government and medical systems can be difficult even for those who have prior experience. Eligibility requirements, proof of disability, and the time frame a person is eligible for services are a few samples of the differences among varying systems. These differences can cause great confusion, frustration, and most importantly, a delay in services received. One frustration noted by several participants is the current trend of using the internet as a means for giving information, answering questions, and filling out forms. Use of the internet-based systems adds an additional struggle for those who lack internet access or are lacking an understanding of computer and/or internet operating systems. A number of barriers were identified, including stigma, lack of resources, ineffective communication, and the built environment. Encounters of stigma have included being viewed as a liar, less intelligent, or defined by their disabilities. Lack of resources include, but are not limited to, insufficient funding and access to transportation services. Access to transportation poses a barrier due to the limited resources and the high costs required to help these individuals gain access to medical appointments, community events, and other needs away from home. The established resources within the community lack funding to continue their work and to broaden their assistance to those living with disabilities. Some barriers are overlooked by others simply because they do not encounter the same problem. Ineffective communication is one such barrier. Examples of ineffective communication methods include information available only in English or on the internet. As a result, further social exclusion often occurs. The final barrier addressed is the environment in which this population lives. Inability to climb stairs into a building, difficulty opening doors, and safety concerns when crossing the street are some of the challenges brought to our attention from participants. Despite all of the challenges that people with disabilities currently face within the Klamath Falls community, it is also important to highlight resources that positively impact them. Participants shared that there are currently several resources available to those within the community. 3 very positive resources were highlighted. Spokes Unlimited is a central location where individuals can gain information regarding various government systems and have access to advocacy, peer counseling, and workshops that aim to improve the skills that impact daily life. The Oasis Drop-In Center is available to those with mental disabilities and is described by those who participated as a safe environment to gain support and socialize. Lutheran Community Services, or LCS, currently offers support to those experiencing substance abuse, mental health issues, disabilities, and a number of other hardships. Although not identified, there are several other resources available. After speaking with participants and reviewing these common themes, we have recommendations for 4 areas of improvement: communication formats, accessibility improvements, transportation, and equitable community activities. Extending efforts to reach more of the community would help decrease communication barriers we currently see. We recommend offering monthly newsletters for new and upcoming community events and resources. Additionally, all forms of communication should be offered in both paper and electronic formats, as well as Spanish and English. Accessibility improvements can alleviate many of the physical barriers that people with disabilities currently face within our community. Improvements, such as audible crosswalks, automatic doors, more sidewalks, and buildings that are readily accessible, are just a few of the ways to achieve this. Improvements to transportation would include more bus stops, a larger service area, and extended public transportation hours. As previously identified, Klamath County has a number of beneficial resources already in place. Recommendations are to first, add more social activities, and second, to add activities that are more inclusive and adaptable to the various types of disabilities. Integration of this population into these established resources will aid in improving the barrier of social exclusion. This information will be given to the Klamath Regional Health Equity Coalition and the Klamath County Health Department for further action. We want to thank the community members who participated, our community liaisons, and you for taking this time to listen to our presentation. Thank you.